it is specially designed for erectile dysfunction in office setting. Now what we have done it for about 422 patients in last 6 years. Each treatment includes a 3-minute application of the shock waves in 5 different anatomical sites. We start with the crura portion on either side, then go on to the shaft, which are we divide into 3 parts depending on the size of the organ. If it's long, then we might go for the 4th side also. Then how it is done, I am going to show you here. Can you play the video here? We hold it here. The video option here. We are actually seeing the penile artery, the caverosal artery on either side, and then the focusing is done on either side, holding the actual organ and focusing onto the dorsal area. Now you can see the video being during the procedure. Most patients actually comply with this. There is no fear, there is no pain, and it is quite simple. Each area takes 3 minutes, so totally 15 minutes is the procedure for each sitting. Now these, how many sittings we have to do? You can see here this is being targeted. The main vessel what is targeted here, because there is a microlithiasis and atheromatoid plaques like in cardiac disease. So these vessels actually, once we bombard this, the microlithiasis will actually disappear and make the stone, make the blood vessel more accessible, more elastic and pulsatile. That's what was there when persons were young, and as age increases, this causes increased rigidity of the vessels, causing erectile dysfunction. This is how it is done. The focusing doesn't cause any hematoma, any pain, or any sort of swelling over that area. In fact, I am trying to show the procedure how it is done. I am actually covering the area for this privacy of the patient. Patient is most often awake. He is cooperating. He doesn't have much fear because we make them feel it with the hand on the wrist for some time. The shock intensity can be increased or decreased based on the compliance and the tolerability of the patients. You can see here the number of shocks. The pulses are 300 each. Automatically it goes up to 300 and stops. So at the end of 15 minutes, the patient can go home. And how the treatment protocol is, see, generally the first half of the treatment, we give weekly twice shock waves sitting. On week 1 there are 2 sittings, week 2 another 2 sittings, week 3 another sitting. After that we give rest of about 3 weeks for the patient to understand and for the angiogenesis to start. And then after the 3 weeks of rest, we again repeat the same procedure, like another 6 sittings, weekly 2 sittings on 6th, 7th and 8th, like that. So on the whole the procedure is around 20 minutes, 1800 shocks are given. The strength of the shock is almost 15% of the intensity that we use for the kidney stones. So most patients, they have tolerated. In fact, we have done more than 1000 patients, but I am presenting here only those patients who have gone through the entire treatment protocol, because majority of patients after first 6 sittings, they drop out because there is a good improvement, they are not able to afford, or they are happy. So it is difficult to keep a follow-up of every patient with whom we started, but fortunately about 422 patients, vasculogenic ED patient. We actually, the criteria is it should be vasculogenic, because the principle of this treatment is angiogenesis and neovascularization. Now cardiovascular disease patients are about 118, and majority of patients were diabetics, and some of them were uncontrolled. So the focus on control of diabetes followed by the treatment. The primary measures, how we measure the response, is International Index of Erectile Dysfunction, ED domain score, and secondary measures are EHS, Erection Rigidity Scale. And how do we follow up is, after these 12 sittings are over, follow up after 1 month, and these patients should not be on PDE5 in between, because we are actually assessing the solo response of this extracorporeal treatment. And inclusion criteria are, there should be ED of more than 6 months, rigidity score of less than 2, and stable heterosexual relationships. In fact, we avoided using homosexuals because it is more difficult to treat ED of a homosexual, because it needs more rigidity, which we are not sure whether this machine could actually do it when we were starting. Prior to surgery, the radiotherapy or any other pelvic surgery were avoided. Any psychiatric patients on anti-androgens or other conditions which are very risky for the sexual activity, like severe cardiac disease, were excluded. Now IIF, how we have seen the response is, In these patients, we use a Doppler before and after, and it shows this is before the treatment was started. There were intermittent gaps in between, and the PSV was much less. And after the treatment, this is how the vessel looked. So it is fortunately, majority of patients, almost 70 to 78% of patients in our experience have improved the blood flow through Doppler. And then in the first, this is first follow-up visit, and this is second follow-up visit. Indicates that 1 month after treatment, there are about 40% of patients who improved, and after 3 months, the response is much better, coming to approximately 80% of the patients. So based on the IIEF domain score and then EHS care, 329 patients of 422 subjects have improved from score of less than 2 to more than 3. Less than 2 is not enough for penetration, and more than 3 is good enough for penetration. That is the core of the issue, that person is not able to penetrate. Once he penetrates, it sustains with the sensation that he encounters in the partner. So the conclusion, this study emphasized the feasibility and tolerability of penile low-intensity shock wave therapy in vasculogenic ED patients who are PDFA responders or non-responders. Majority of these patients before our treatment were not responding even to 100 mg of PDE5s, but later on, after 3 months, at least half of patients were saying some response is there if they didn't have satisfactory response with our treatment alone. No reported side effects, and most patients have well tolerated. It shows significant improvement in patients with erectile dysfunction remaining for at least 6 months. See, we can't treat somebody at 2 months of ED because maybe there are psychological factors or functional factors or disaster in the home which can cause ED temporarily. ED SWT can also be used effectively to treat a subgroup of patients who have failed oral medication. Surprisingly, some patients do not respond to PDE5 from the beginning. So these patients are so disappointed and they are not willing for surgery or they can't afford surgery. It's a good option because it's affordable, it is repeatable, and if somebody is not happy, we can do some more sittings. One patient asked me how many you can do maximum. We told it is just generous 12, but he said he can go on. The maximum we have done for a patient is 24 sittings, and he was happy that every sitting was giving a little more response. At the end of 24 sittings, he was more happy. Most of the patients are coming from abroad, like Middle East, something where they cannot come back. So they are asking us to do little more sittings because it's affordable. This study emphasizes physiological effect of low intensity shock wave therapy on the erectile apparatus, and further studies are needed to fully evaluate the methodology and even improve its efficacy in patients with Peyronie's disease. We have done some patients with Peyronie's disease where we have cracked the calcium deposits, but we don't have enough numbers to actually present. But whatever is the hard area in the vessel wall or around, there can be microfractures which actually improve the functionality. Man survives earthquakes, experiences and horrors of illness and all of the tortures of the soul, but most important, tormenting tragedy of all time will be in the tragedy of bedroom. Thank you.
Thank you, Dr. Sridhar.
Yes, sir.
Dr. Sridhar? Hello.
Are there any guidelines for how long this effect is going to last?
Yes, sir. Yes, sir. The results show that they go on up to 8 to 12 years. 8 to 12 years. Our longest follow-up is more than 8 years. Majority of patients are between 6 and 8 years. We are not repeated on them. If somebody has some objection, once or twice we have done a sitting for them. But the ultimate long-term, it's a long-term treatment, sir. It is not just a temporary one, because we are selecting patients